name is Brittany, and I'm going to go over with you how to take care of your wisdom teeth extractions. We're going to send you home with a couple of extra packs of gauze to change out at home. When you take it out, it will look like this. Go ahead and fold it in half again, and wrap it into a little square. Place it directly over the area and bite together with some nice firm pressure. During this time, you want to make sure that you keep talking to a minimum so that your gauze stays nice and in place. You'll change it out every hour and a half to 2 hours. Once there's no more bleeding or the gauze has a lighter pink color to it rather than a red color, you don't have to bite on any more gauze. At that point, it'll just be a light trickle. You can go ahead and place a towel over your pillow overnight to help keep your pillow nice and clean. Bruising and swelling is common. If you were given a prescription for ibuprofen, go ahead and take that as prescribed, as this will help to minimize any swelling you may have. You can also do some ice packing on the outside of your cheek the next couple of days after your procedure. You can do 10 minutes on, 10 minutes off, or for however long you can tolerate it for. After the first couple of days of ice packing, if you notice any swelling, that's normal. At that point, go ahead and switch over to a warm compress. This will help to move around the circulation in the area, and we'll have you do that until the swelling goes down. Swelling usually peaks on about the second or third day from your appointment. From then, it should slowly start to go down. If you were given a prescription for Tylenol, you can go ahead and take that with your ibuprofen as needed in case your ibuprofen isn't enough. You may have also been given a high-strength pain medication such as Norco to take as needed with your ibuprofen. This cannot be taken with any Tylenol, as your Norco has Tylenol in it already. If you were giving any antibiotics to take after your procedure, go ahead and take that as directed. For your oral hygiene, you're not going to do any brushing, rinsing, or spitting the next 24 hours after your procedure. The following day, once there's no more bleeding, you can go ahead and brush the rest of your teeth, avoiding the areas that were worked on. Instead of mouth rinse, go ahead and do warm saltwater rinses in between meals to help keep the areas nice and clean. You can make your warm salt water with a cup of warm water and a teaspoon of salt. For your lower wisdom teeth areas, you will be given a syringe to help clean out those sockets, and it will look like this. You do not need to use this for the upper wisdom teeth areas, as the warm salt water rinses will help clean those areas out. For your syringe, you will take this out starting the third day after your procedure with a cup of warm salt water. Go ahead and fill this all the way up, stand in front of a mirror, take your finger or the back of a spoon to pull your cheek out of the way so you can see. Once you pull your cheek back, you'll see a tiny hole on both sides of your cheeks. And you'll take your syringe, go about ½ an inch inside the wound, or at least make sure this tip is inside the wound. If you're not inside the wound and you're cleaning just on the outside of it, it will not clean anything out. So once you insert the tip inside the wound, go ahead and flush all the food and debris out. You'll do this more than once until the water runs clear and until you get all the food out. You'll do this after every meal for the next 2 weeks after your procedure. After the first 2 weeks, you can then switch to twice a day, morning and then at night, until the wounds fully heal. It can take about 4 to 6 weeks, give or take, but during that time it slowly starts to get smaller and smaller. If you're a smoker, you want to make sure that you avoid any smoking the next week after your procedure, as this will help to avoid any type of healing delays. For sutures, we may place a couple of stitches in the areas. If we do, they're all dissolvable and they'll fall apart on their own within about a week after them being placed. For IV anesthesia, one of the most common side effects is nausea. We do give you an anti-nausea medication through the IV at the end. However, if you do feel nauseous once you get home, sipping on some carbonated drinks will help to settle your stomach. If this gets worse, you can always call us and we can always prescribe you an anti-nausea medication as well. For your diet, you want to have a colder, softer, mushier diet. Things such as scrambled eggs, mashed potatoes, and yogurt. You're more than welcome to have a smoothie. Just make sure you either drink it with a cup or eat it with a spoon. No straws the next couple of days after. You can also have soup as well, but you want to make sure that it's either lukewarm to cold. You want to avoid any types of foods that are hot temperature-wise, spicy, or acidic, so you don't irritate the areas. On about the 3rd or 5th day after your procedure, you can go ahead and start to slowly resume your normal diet. You also want to make sure that you get plenty of rest during the next 3 to 5 days after your procedure. On that 3rd or 5th day, depending on how you feel, you can go ahead and resume some light exercises. Once you do get your heart pumping, make sure you take it really easy because the areas can start to ache and throb, maybe bleed a little bit again. But your body will let you know how you're feeling. If you have any additional questions or concerns, please feel free to give our office a call.